Good morning, ladies and gentlemen. My name is Fritz Pearls, and I am the therapist behind Gestalt Therapy. Today, we will be looking at a video focusing on the techniques and practices of Gestalt Therapy with our client Claire. She is a 34-year-old female presenting with life stressors. Throughout this video, we will see different techniques of Gestalt, and I will be there to explain more of them as my fabulous clinician, Dr. Lizabine, explains the therapy more. Enjoy.
Hello,
Hi.
I'm Dr. Lizabine. How are you doing
Hi,
today?
Dr. Lizabine. I'm good.
Good. What's
I'm
your
doing
name?
okay. I'm Claire.
Hi, Claire. How are you feeling today?
I'm not doing so good today. I'm feeling pretty depressed, pretty anxious. Can't really control what's going on. I'm pretty overwhelmed. I'm feeling like I just don't want to do today anymore.
Don't want to do grown up today.
Yeah, it's just too much.
I'm seeing a lot of motion in your body language. What's this about?
So as you just saw, Dr. Lizabine asked Claire what her body movements were expressing. Through this process, we call it exaggeration. We ask our clients to exaggerate their body movements and bring feelings to these movements in terms of externalizing their feelings and bringing emotions to these movements. Next, Dr. Lizabine will ask Claire to exaggerate these movements throughout the rest of the therapy session and recall what feelings these movements display.
I didn't know I was doing that. I don't know. I guess I just talk with my hands a lot. It makes me. I don't know. I don't know what that's about.
Okay. I think while we're having a conversation, I want you to practice making that more pronounced.
Doing more hand movements.
Mm-hmm. Yeah.
Okay.
Bigger. Can you do bigger ones?
I'm feeling self-conscious. I guess. Yeah.
I see a big smile.
I feel silly.
Okay.
Okay. So, I guess I'll just try and keep doing them.
Bigger.
Even bigger?
Mm-hmm.
Okay.
Thank you.
Yeah.
Okay, so tell me kind of what's going on in your life right now.
So I'm currently getting a divorce from my husband. I have 2 small girls, and I just didn't realize. There I go again.
Bigger.
I didn't realize that this was going to be such a difficult transition. My husband is the one who's filing for divorce, and so it was just, first it came as a surprise, and 2, I just feel like I can't keep it together. I can't keep things together. And I think maybe that's where my hand motions are coming from, because I realize I'm scooping, and I feel like my life is getting away from me, and so pulling it close, that's kind of when you said to exaggerate them, that's what it kind of makes me think of. I want it to stay close and somewhere in my control. I just feel like everything is so far out of my control right now.
So what I hear you saying is you're out of control, and I kind of see some anxiety and maybe a little bit of fear.
Yeah, I'm really scared. I don't know what the future is going to look like now with my husband gone. We've been together for 17 years. That's a really long time. That's half of my life. So I don't know what it's going to be like. I'm scared. I just started working recently because my girls are now in school, and so I don't know what it's going to be like anymore. What my finances are going to be like. My family's breaking apart. What my girls are going to think. We've been partners for so long and everything, and now all of a sudden he doesn't want to be a part. He doesn't want to be a family anymore.
And when you say he doesn't want to be a family anymore, what does that make you feel right now?
Just, alone, like a little girl. I'm scared, like I was when I was a little kid.
Like a little kid? Are you feeling like a little kid inside right now?
Yeah, I feel I remember feeling like that when I was a kid. Everything was so far out of my control that it was I didn't have a lot of power. I was totally powerless, and that's definitely how I feel now, too.
Okay. So I'm seeing this little girl inside of you that's a afraid and scared, and I'm wondering what we could say to that little girl inside of you. And I'm going to ask you to do something a little strange. Are you okay?
You already asked me to make weird hand movements.
I did.
So I guess.
I did.
Okay, I'm up for trying something.
Okay. What I'm going to have you do is I want you to talk to the little girl inside of yourself. But I want you to talk to her like she's sitting in this chair. So if you want to turn your whole body and look at the chair and talk to the little girl.
What should I say?
What if you saw the little girl, how is she acting right now inside of you? How would you address her feelings? You're the mom, right? You're the adult now.
Yeah. So just talk to her like I would my girls?
Yeah.
Okay.
But it's yourself.
Okay.
So this next technique we will explore is called the empty chair technique. In this technique, the clinician helps the client to adjust their inner feelings by becoming more aware of bringing the past into the present. We work to help the client externalize these feelings by bringing a voice to the feelings through kind of a conversation between themselves and the chair. Through this expression of feelings, it helps to bring about personal insight and by integrating different aspects of that person's personality. This intervention helps the client move from talking about something to the immediate experience of their feelings and emotions. As we will see, Dr. Lizarbean will help Claire explore her inner feelings of her inner child and then her feelings as an adult.
Claire, I know you're really scared right now. And I know that you feel like this is like the second time that this has happened that I've kind of, that you are disappointed probably that I've let us down again and like let someone leave our life, but everything is going to be okay. I'm much stronger now, and you can trust me, and I'm going to take care of us. Like that.
Mm-hmm. But now I want you to be the little girl. I want you to tap into the little girl and talk to your adult self. So I want you to actually sit in the other chair.
And be my younger self.
And be your younger self.
That sounds scary.
Are you okay with that?
Yeah, I think so. I think I haven't thought about being that little girl in a long time.
Okay.
So switch places?
Switch places. So you're your inner child talking to your adult self.
Okay. Claire, I'm really mad at you. I can't believe that you did this again. Like, here we are in the same situation we were again, and, you know, you were going to get us out of that and, you know, make us a family and we could be strong. And you worked really hard, but you definitely let us down.
Okay. So come back, be the adult. What do you kind of hear from your child self?
I mean, I said the word disappointed.
Okay.
Like I let her down.
So I'm feeling a lot of judgment and fear and self-blame. Are those things that you're feeling as well?
I think so. I don't know if I meant to do that. I don't know if I really recognized that that's what was happening inside of me either until we did that.
As the client begins to bring awareness of their internal feelings and emotions, the therapist helps bring the client into the here and now. The here and now is a foundational aspect of Gestalt Therapy. We only talk about the past in order to relate it to the present. The goal is to have the client identify how their past is impacting their present feelings, with an emphasis on having them focus their energies and attention on how they are feeling in this exact moment.
So how are you feeling right now after doing that exercise?
My stomach hurts. I can feel like a lot of tension and like that sad, like heavy feeling on the inside of like wanting to take care of that little girl.
Okay. Do you feel like you're a protector?
No, I feel like a failure.
Okay.
I feel like I must have done something wrong along the way.
So the phrase you're saying is, I'm a failure and I've let people down in my life.
Yeah.
Do you think that you're a strong person?
Yeah, I do. I mean, if I think about my past, and like my parents died when I was really young, and so they both died in an accident at the same time. So I lost them both, and I think that I'm kind of remembering those moments of feeling really alone and out of control, and I think that that's part of like what like the little girl was so disappointed in, is feeling alone again. But I worked really hard to be where I am, and I overcame a lot, and I'm not a bad mom, and I'm not a bad partner, and I survived a lot to be where I am.
Do you think you deserve to be loved?
Yeah, I do. I think everyone does. I extend that to myself too.
Okay. And you're strong.
Yeah, I am strong.
Okay. So I hear a lot of, I'm a failure and I'm weak from your inner child, right? Those are the themes that you're feeling.
Yeah.
So I want you to say that.
Which part?
I'm a failure and I'm weak.
I'm a failure and I'm weak.
And I want you to replace that with, I'm strong and I deserve to be loved.
I'm strong and I deserve to be loved.
I want you to say it again.
I'm strong and I deserve to be loved.
I want you to say it like you own it.
I'm strong and I deserve to be loved.
How does that feel?
It feels like I want it to be true.
Okay. But those are true things.
Yeah, they are true things.
Okay. So when you're feeling those negative thoughts of I'm a failure, I want you to flip that around and just say out loud, I'm strong and I deserve to be loved.
Like whenever I'm feeling like that little girl and scared, I can say that to myself.
Yes.
Like, I'm strong and I want to be loved.
Not I want to be loved.
I deserve to be loved.
I deserve to be loved.
I'm strong and I deserve to be loved. Okay.
Do you think you can do that?
Yeah, I think that kind of reminding myself that those are values that I have and that I really actually believe them, but just having to remind myself, I think that's helpful.
Okay.
The technique we just saw was what we call reversal and then rehearsal. During this exercise, the therapist suggests that the client reverse a statement that has been made, and this encourages the client to state the opposite and often leads to greater awareness and acceptance of internal feelings. For example, when Claire was encouraged to reverse her statement of I am a weak and a failure, and replacing that with I am strong and deserving of love, she became more in touch with that part of herself that really wanted to be expressed. Rehearsal then requires the client to practice the newly stated reverse statements in order to encourage change.
Okay. What other types of values do you have that you're kind of struggling with right now?
I guess sometimes I feel like I'm not showing my kids how to, I don't know, like part of it is I don't feel like a great mom because I failed in my marriage, and so how are my girls supposed to know what a good mom is like and what a good wife is like, or what a good partner should be?
Well, describe to me what a good mom would look like.
I guess in my head it kind of is like a good, wait, did you say mom or partner?
Mom.
A good mom, it should be someone who always wants them to be happy and sacrifices a lot for them and lives her values so that the kids can see what that looks like.
Okay. So I hear
that's really weird. Because if I'm feeling so weak and telling myself I'm weak, I'm not living the value of I feel like I'm strong, and I do.
Okay. So what does it feel like to have that moment of clarity?
I mean, it seems kind of silly that I'm so wrapped up in feeling weak when a marriage is two people coming to the center and meeting halfway, and I can only do 50% of the work. So it kind of seems like I'm giving myself I'm being a little too hard on myself.
Okay.
This technique is what we call encouragement. As the client is the expert, the therapist's role is to use the client's own words to encourage the client to continually be aware of their feelings and emotions while practicing the reversal statements as they move forward.
So in that realization, you're being too hard on yourself. Do you
Yeah.
feel any pressure release or?
Yeah, I do. I kind of feel like a little bit of tension from my shoulders is gone.
Okay. So acknowledging that you are your own person and you can only do so much in your relationship.
Right.
Okay. Well, that's really good.
Yeah, it feels good. It feels like that's a healthy thing to feel.
Yeah.
Instead of so much pain and so much pressure.
Yeah. I'm feeling a lot more positivity from you all of a sudden. I'm kind of seeing the strong woman come out.
Yeah, I feel more positive. Even just thinking about, it kind of takes a burden off of me from, I don't have to fix this. I can do 50% of the work. And it still might not work out, but it doesn't mean that I'm a bad mom.
No. But where can you do 100% of the work?
I can only do 100% of my own work.
Okay. So before you were talking kind of about wanting your children to feel a certain way or think a certain way or act a certain way. And I kind of want to know what it would look like for you. How would you know that you're being a good mother?
Oh my gosh, I don't know. How does anybody know if they're being a good mother? What would it look like?
Mm-hmm. What are the things that you would do, say, model for your children?
I could start with letting them see me tell myself I'm strong and I deserve to be loved.
Okay.
Because I feel like that does show them that, it's a lot all at once. It's showing them that, I have a lot of feelings and that I can be sad, but that I also believe in myself and that, I believe in where I'm going. I think them seeing that, the vulnerable side of me and the strong side of me, that's a human mom.
Okay.
I like that.
Okay. So we're not trying to be super mom and my kids feel and do these
No.
perfect things. Okay.
Right.
So letting them know that you're human and you're going to have sad days and happy days.
Yeah.
Okay.
I think that it's important for them to see that I'm human and to know that they can be humans too.
So I want to kind of let's take a look at how you're feeling now.
Okay.
With all the things we've kind of discussed on what you can do to show your children that you're a good mother,
Mm-hmm.
feeling strong, feeling like you deserve to be loved. How are you feeling in this moment?
I feel a little bit of relief. It feels good to get all this off my chest. It feels and I remember the hand movements of it feels like it's coming out.
Okay.
Instead of needing to pull it in. And I feel like I have less tension in my shoulders. My stomach ache is gone from when I was talking to myself as a little girl. I just feel generally a little bit more at ease. My body's at ease. My mind is at ease knowing I don't have to do all the work.
Okay. All right. Well, I think what we're going to do now, I see that you're being very strong and positive, and we've kind of shifted from that guilt, failure frame of mind to a very positive, can-do frame of mind.
Yeah.
And I see your body's just much more excited and exuberant. Are you feeling that?
Yeah,
Okay.
I think so.
Has this talk been good for you?
Yes, oh my gosh. You just kind of encapsulated what it was like to go from that tension to the release.
Okay. So we'll try and set up another appointment and maybe just do a couple more and see how you're feeling in the future.
Yeah, I would really like that.
Okay. Thank you so much, Claire.
Thank you.
1, 2, 3, 4. Existential theory, know the why and how. Gestalt Therapy will have you share. So come on over and talk to the chair. Find a well-known movement and act it out. Reach your inner demon, address your fear. Bring oppressed feelings out in the air. So come on over and talk to the chair. To end the session, become aware. A shift of perspective will make it clear. Can't look to a therapist to make it fair. Come on over and talk to my chair.
I couldn't remember your last name. That's okay. That was so good!
Good evening. No. My practitioner, Dr. Elizabeth. Oh man, that's not what I want to say. So today we'll be watching the video.
So this video will show examples of Gestalt therapy and
Scene. Through this process, Dr.